That's coming up in about 15 minutes.
You may be doing this right now, but you know it's back to school week here on You and Me this morning, so it's time to open up and say, we're talking about your pearly whites today, and there are some things that actually every parent needs to know before sending their children off to school. So joining us now with that information is Dr. Milad Nourahmadi of Shining Smiles. How you doing today?
I'm doing great.
Did I do okay?
You did awesome.
Okay, awesome. Because can I tell you something? We're always paranoid when everybody comes, like when the hairdresser comes in, we worry about the hair. When the dentist comes in, we worry about our teeth. But actually, we were talking about something in the meeting yesterday that surprised me because I'm not a parent, but there are actually requirements from the state that the dentist has to help parents with. What's that?
There are. So one of the things that a lot of people don't know is that the #1 chronic illness that affects children, it's not asthma, it's not diabetes, it's actually tooth decay. Yeah. So,
wow.
Yeah,
I
most
didn't
people don't
realize
know that.
Yeah.
And tooth decay actually accounts for a large percentage of why kids miss school days. It's actually
with toothaches,
and things like that. So what the state did is to try and reduce those numbers. They created these mandatory exams for children.
Oh, okay. So you have to take your kid to the dentist and get a checkup. Is it at certain ages that they have to do it?
It's at certain grade levels. So
okay.
Kindergarten, 2nd grade, and 6th grade are the mandatory grade levels.
Right. And taking care of your teeth when you're young, like I think a lot of us think with our baby teeth because they fall out, that's not really important, as important to take care of them as it is to do the permanent teeth. But there is a reason for that?
Yeah, and that's one of the biggest misconceptions that I deal with on a regular basis with parents. It's that they come in like, oh, they're going to fall out, just leave the cavities in there. And the problem is that statistics show that about 1/4 of preschoolers have visible decay. So that's not something that the dentist sees. That's something that other kids see, other parents see. And it leads to, one, certain types of infections in the mouth that can actually spread and can even cause death.
Wow.
Yeah.
Okay, I wasn't expecting that answer today. I was thinking, oh, it affects your future teeth or something like that. That's amazing.
Yeah.
And then you don't want your kid to be picked on at school.
Exactly.
That's really what it comes down
yeah.
to. All right. So now the other thing we were talking about this yesterday. I don't know about anybody else, but we had a little discussion about the proper way to brush our teeth, and it never hurts to revisit it. So you brought some props along.
I did.
And I don't know about this guy as a model. He's missing a couple of teeth here.
So he's missing some teeth, but he's learned his lesson, and now he's going to show you how to properly brush so you don't lose any teeth.
So what do we do? And this is something that I've had arguments with friends about. Do we floss first or do we brush first?
The order of brushing and flossing doesn't really matter so much.
Oh.
Yeah, so you can do either or. As long as you're doing both, doesn't matter what.
All right. And do you need to floss twice a day the same way you need to brush twice a day?
Absolutely. Actually, one of the things that a lot of people also don't know is that flossing is more important than brushing.
Get out.
Yeah. If they asked me, you know, if I was stuck on an island and I could either take my toothbrush or my floss, I would take my floss.
Oh, because it saves your gums.
Because it saves your gums and it saves your teeth and the bone that holds your teeth in place.
Okay, so you can have pretty choppers. So what are we going to do first here?
Okay, so first let's go over proper brushing. So one of the things that people don't know is that when you brush, half the toothbrush should be on your gums and the other half on your teeth.
Oh, so you have to brush your gums too.
So you have to brush your gums too. The #1 area that plaque builds up is around the gum line. So if you're not brushing that area, you're just going to get all that nasty staining around the teeth and then the bone loss.
And if you drink coffee or smoke or do any of those kinds of things, drink red wine, you're going to see it even more.
Oh yeah,
right?
you'll see it even more, especially around the gum line.
So
that's the first thing. The second thing is that the angle at which you hold the toothbrush is key. So most people just hold it flat and they go back and forth, or they do some type of circle motion. So the correct angle is at a 45-degree angle toward the gum line.
Oh.
Yeah, so you never want to hold it completely flat. You want to hold it at 45 degrees, half the toothbrush on your gums and the other half on your teeth, and then just go back and forth.
Okay, so we're just cleaning out all that junk in there.
Exactly.
And the same thing on the top ones, just towards your gums, so you do it up. Now, does it matter what kind of bristles you have, softer?
Yes, it does. A lot of people think, oh, the harder the bristle, the better it cleans, but it's not a tub. So if you use hard bristles or if you use medium bristles, it actually wears away at the enamel of your teeth.
Ooh, so that's why your teeth can be sensitive, huh?
Exactly. So nothing but soft.
Okay, I'm with it. I love the comparison. Your teeth are not your tub, people.
Yeah.
For more information on all of this, you can visit or call Shining Smiles. All the information is right there on your screen. Thank you so much.
You're welcome.
I hope you'll be seeing a lot of the little ones at your practice to help them learn how to brush their teeth, because if I was somebody's mama, I would not be teaching them right.
Definitely.
But now I will.
Yeah.
Thanks a lot.
Thanks.
All right, next on Back to School Week, dorm decor for young men and young women. We'll show you some of the newest trends and